Dr. I and Dr. J are back to give you some insights on all those burning health questions you've been wondering about as we're now officially in 2025. Hey, guys, Happy New Year's.
Happy New Year.
You know, some of these questions I have today are New Year's resolution theme. Before I get started, do either of you have any resolutions you care to share with the class?
I do have a resolution. I really want to perfect my Spanish and start learning a little bit of Arabic and Hindi. Weird languages, I know, but that's my resolution.
Wow. Wow, that's reaching high. Yeah, I don't know how to follow up with that either. I just hope to read a couple more books than I did last year. Okay, let's get straight to it, because New Year means quitting some old habits for a whole lot of people. You know, for some, it could be smoking. So let's start with this, true or false. Every cigarette you smoke takes 10 minutes off your life. I'm going to say false. False.
That is false. That is false. But the bad news for smokers is it actually takes 19.5, so basically 20 minutes off of your life. So if you look at 3 cigarettes, that's an hour. A pack of cigarettes is about 6.5 hours off of your life, and that is compounded over cigarette, over cigarette, over cigarette, year over year. And it makes sense when you think about it. Cigarette smoking reduces blood flow to the brain, to the heart, increases the risk of heart attack, stroke, a whole host of cancers, lung cancer, breast cancer, colon cancer. So cigarette smoking doesn't do anything good for you. The good news, however, is that, yes, if you continue smoking, you're going to lose about 20 minutes per cigarette. But if you stop, you get all of those hours, days, years back. And it doesn't matter the age. You can stop when you're 50, when you're 60, when you're 20, doesn't matter. Stop and we'll give you those years.
How do you find that it shaves that specific amount of time off? Like, what's the science there?
So basically what they did is they looked at people who were in similar situations, so similar ages, similar health situations, but they looked at those who smoked and those who didn't smoke, and that's how they, because at first I thought it was 10 minutes per cigarette, but that's how they actually discovered that it's closer to 20 minutes per cigarette.
Wow, really good to know, and for a lot of people to keep in mind. Now to this, actress Gal Gadot recently came out and said she had a massive blood clot in her brain during pregnancy. True or false, pregnancy increases a woman's risk for stroke? I'm going to say true to that.
Yeah, that's true. So a lot of people are surprised to find out that when you become pregnant, your risk of clotting increases by anywhere from 5 to 20 times. And it kind of makes sense if you think about it. You know, the body is concerned with having a healthy mom and a healthy baby. And so one thing the body says is, well, we can't have any significant bleeding episodes during the pregnancy, during the labor, or afterwards, because we don't want to lose mom, we don't want to lose baby. And so when women are pregnant, their body makes more of the proteins that promote clotting, fewer of the proteins that prevent clotting, and so they tend to clot more. Problem is, in some people, and there's a variety of reasons why this can happen, they're more prone to getting these pathological clots that can develop in the legs, go to the lungs, go to the brain, and cause strokes, basically. And so we tell pregnant women, hydrate. That actually decreases the risk of clotting. Get moving. Blood that's not static tends to clot less. And sometimes, and this is something to talk about with your doctor, but sometimes taking blood thinning medications, like even a baby aspirin, can help as well. But yeah, it's true. Pregnancy can be a wild and scary time.
It's wild. I'll tell you firsthand, it's not for the faint of heart in any way, shape, or form. Hey, Dr. I, this one might be good for you. True or false, being bilingual can help prevent dementia? Oh, I'm supposed to answer. Hold on, wait, hold on. Mom brain. I'm going to say true to that.
It is actually true. So that when you're bilingual, you increase what's called neuroplasticity. So your neurons are more flexible. They're more able to do things. So they've actually done brain scans on folks that are bilingual when they're speaking, you know, their native language as well as a second language, and the brain scans actually light up more. And so not only does it help with neuroplasticity, but it also helps with memory overall. And if you do develop dementia, it tends to be at a later, at a later age with lesser symptoms. The good news is you don't have to be born or you don't have to be bilingual from a young age for this to work. You can, like me, in your late 30s, start learning another language. It helps to reduce the onset of dementia. So it works no matter the age that you are when you start. Doesn't matter the language. 2 languages or more help to reduce dementia and improve memory.
Yeah, you don't look a day over 29, Dr. I. Yeah, I don't think having a newborn at home helps in that department either. My brain is just on a delay constantly right now in this chapter of life. Thanks for watching, everybody. Go to joinnn.com to find NewsNation on your television provider. Also, don't forget to click that red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.